Welcome to the Maternity Mentor. Today we will be talking about how vitamin K protects your newborn baby, which babies are most at risk of vitamin K deficiencies, and what vitamin K can and cannot do for your baby's health. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I am also an IBCLC, I am maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Vitamin K use in newborns has become a very controversial subject in the last decade or so. The American Academy of Pediatrics reports that record numbers of parents are refusing this life-saving medication. As a nurse, I have administered a fair amount of vitamin K shots to newborns. Likewise, I have educated a fair number of nervous parents on what vitamin K is and why it's so important. Let's explore why vitamin K is so essential for your baby and the reasons why you should consider it. Vitamin K is a vitamin. It is used by our bodies as part of our clotting system to help prevent us from bleeding too much if we get cut or injured. We get 90% of our vitamin K from our diet in the form of leafy green vegetables we eat. The other 10% is made from bacteria in the intestine that naturally occurs in our body. Babies are born with very low levels of vitamin K in the body. Additionally, babies have very little bacteria in their bodies to start producing vitamin K, and don't ingest the foods necessary to obtain vitamin K quickly. The bacteria are obtained in the first few months of life and colonize the intestine. As this happens, your baby starts to produce enough vitamin K on their own, usually by 6 months of age. A vitamin K shot has been recommended after birth for decades by the American Academy of Pediatrics. This is to prevent a life-threatening condition called vitamin K deficiency bleeding, or VKDB. VKDB can also be called hemorrhagic disease of the newborn, or HDN. While rare, VKDB is a serious, potentially life-threatening condition for newborns and infants. VKDB is considered rare in the United States and Europe due to the routine administration of vitamin K after birth. However, in parts of the world where this isn't done, VKDB is considered common. 1 out of every 5 babies with VKDB die from the disease. Babies who do experience VKDB can have serious consequences, including long-term neurological, cognitive, or developmental problems, gross motor skill deficits, organ damage, brain damage, and death. All newborns who do not receive the vitamin K shot at birth are at risk for VKDB. In addition, there are other babies who are at increased risk, including premature babies, late preterm babies born before 37 weeks gestation, medically fragile babies, babies with breathing problems at birth, babies bruised at birth, babies born using forceps, babies born via cesarean section, babies born to mothers taking a variety of prescribed medications, including medications for epilepsy and blood thinners, babies born with liver problems, and exclusively breastfed babies. Breast milk does contain vitamin K, so most parents think that it will prevent VKDB. However, the amount of vitamin K is too small to provide protection. Formula-fed babies are at less risk because formula contains more vitamin K than breast milk. However, it is still recommended they receive the vitamin K shot due to formula having lower than suggested vitamin K levels. Currently, nearly all babies diagnosed with VKDB are exclusively breastfed babies. There are 3 times that VKDB generally occurs. Early onset disease occurs within the first 24 hours of life. Classic disease occurs between 2 days and 7 days of life. Finally, most parents don't realize that VKDB can occur later. This is referred to as late onset disease, and it can happen anywhere from 2 weeks of life to 6 months of life. Late onset disease occurs especially in babies who have liver or bowel disease, as well as exclusively breastfed babies. If the baby is experiencing VKDB, they often don't show signs of the disease until it is in the life-threatening stage, which is often too late. Warning signs to look out for include easy bruising, bruising particularly in the head or face, bleeding from the umbilical cord or nose, paler skin color than usual, pale gums, blood in the stool, stool that is dark, black, or sticky, yellowing of the whites of the eyes, worsening jaundice over the age of 3 weeks, irritability, excessive sleepiness, vomiting blood or vomiting more than usual, and seizures. Bleeding from the circumcision site can also be a sign. However, it should be noted that most healthcare practitioners will not perform a circumcision unless vitamin K has been administered due to the risk of hemorrhage. If you see any of these symptoms, you need to seek immediate medical assistance with your pediatrician or in the emergency room. Before we continue, please remember to hit that like button and subscribe so we can continue to create this content. Now let's talk about how to prevent VKDB. The primary prevention of VKDB is the administration of a single vitamin K shot within 2 hours of birth. This is an intramuscular shot given in the thigh muscle of your baby. This single injection is well absorbed and will protect your baby for months until the baby is able to produce vitamin K independently. The American Academy of Pediatrics recommends a dose of 0.5 to 1 milligram be given. Many parents are worried about the shot because it causes their baby pain and will sometimes leave a little bruise. To assist with these fears, healthcare facilities will often allow parents to hold their baby's hand or even hold the baby while the shot is being administered. Additionally, placing the baby immediately skin to skin after the shot will help calm the baby down and produce endorphins, which relieves pain. Mothers who are breastfeeding can also breastfeed immediately afterwards to reduce pain. Without treatment, the risk of developing VKDB is 81 times higher than babies who receive the vitamin K shot. The diagnosis and treatment of VKDB involves many more painful blood draws and procedures than one shot does. Another option that has been utilized, especially in Europe, is oral vitamin K. This is not recommended because it is not well absorbed and does not provide the same timely protection as the injection does. If parents insist, it is given as a series of 3 doses, at birth, at 5 to 7 days of life, and at 6 weeks of age. Some issues with oral vitamin K include lack of absorption due to gut issues, babies vomiting and then requiring additional doses, and forgetting additional doses leading to lack of vitamin K protection. Be aware, 1 to 6 babies per 100,000 babies will develop late-stage VKDB after receiving oral vitamin K. Oral vitamin K is generally not available and not used in the United States. Many parents have read that vitamin K is not safe for their baby because of myths that are widely circulated. Let's debunk these myths. Myth number 1, vitamin K shots are not safe. Vitamin K is safe for all babies, including sick and premature infants. Myth number 2, vitamin K shots cause cancer. A very small study was conducted in England of approximately 800 babies in the 1990s. It showed a link between vitamin K shots and leukemia. A year later, 2 much bigger studies, one with 1.4 million children and another with 500,000 children, showed no such link to leukemia. Many additional studies have been done since, and to date, the results have all contraindicated this one small study. Myth number 3, vitamin K shots cause jaundice. The only studies to link vitamin K to jaundice are studies of premature infants who are already a high-risk population for developing jaundice. Those infants receive 30 to 60 times the normal dose of vitamin K. Myth number 4, delayed cord clamping will provide my baby with all the vitamin K the baby needs. Delayed cord clamping is awesome for many reasons, including being a great source of iron to prevent anemia. However, it does not supply vitamin K. Vitamin K is stored in the mother's liver and does not pass through the placenta, and therefore will not be passed to the baby. Myth number 5. I can eat foods with vitamin K to give my baby vitamin K in breast milk. All the foods high in vitamin K are great for your diet and definitely recommended for your health and well-being. But neither foods nor supplements will provide your baby with adequate amounts of vitamin K in the breast milk. Vitamin K does not readily pass through breast milk and will not be available for absorption by your baby. Finally, myth number 6. Vitamin K is a vaccine. Vitamin K is not a vaccine. It's a medication. I respect everyone's opinions and feelings on vaccines. However, every time I work with parents who are refusing both the vitamin K shot and the hepatitis B vaccine, I take the time to educate them on vitamin K. I ask them to go online again and research this decision. I explain the risks of not receiving the injection and encourage them to speak with a pediatrician. I feel strongly that all babies should receive this medication. The example I use is this. What happens if tomorrow you get in a car accident that is not your fault? What might happen to the baby without this medication? A minor car accident could turn into a major injury for a baby who has not received vitamin K. Vitamin K is one of the most important medications your baby may receive. It's also one of the first medical decisions you will make for your baby. I hope this has explained why it is so important and helps you decide whether to allow for your baby to receive this medication. Please share your comments and let us know what topics you would like to hear more about. If you like this content, remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.